Okay. Now, doctor, as you explained the symptoms, which is mostly related with frequency, urgency, and many a times it may also have incontinence,
Slow space.
nocturia, I mean, right, getting up during night to pee is
Mm.
also there as an important symptom. But the thing is that these symptoms are so common after a certain age. When we talk to our elders that if you have these symptoms, let's go and talk to a neurologist, they'll often say that, no, 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 now I'm aging. So, this is bound to happen. I'll have to live with it. Or, I'm a diabetic or, other patients. So, are there other medical conditions where similar, symptoms can be seen?
Yeah, yeah. I think it is a very apt question. When I ask these type of symptoms to a patient who comes to my clinic in 70s or 80s, they say, doctor, this is age related. I've been living with these symptoms for many years. They think it is normal for the age, but it is not normal. And when you examine, the patient may be having a full bladder, he'll be passing urine with very slow stream. So this is because of lack of awareness. So a 60 or 70-year-old person also should be able to pass urine freely without any obstruction. So it's a misconception or a myth that as age increases, they have to live with these urinary symptoms. So if the patient of above a 50 has these symptoms, they have to consult a urologist and get them evaluated for BPH or whatever. So another question what you asked is, are there any other conditions which can cause
Hmm.
similar type of symptoms?
Yes.
As you said, the diabetes, long-standing diabetes which is present for more than 10 or 15 years, can affect the bladder. Of course, you all know that diabetes affects all organs, and a condition called diabetic cystopathy occurs in patients with long-standing diabetes. In this condition, the bladder becomes weak. It cannot expel the urine. It cannot contract enough to expel the urine uh, from the bladder. So they retain a lot of amount of urine, and they can have symptoms like frequency, slow stream. So we do need to do certain tests to differentiate it from the prostate enlargement. The symptoms are similar to prostate enlargement. Other condition called stricture of the urethra. So the below the prostate, the urine goes through another tube called urethra, which is present in the penis. So if there is any obstruction in this urine passage, any scar or fibrosis, it is called stricture urethra. The symptoms are almost similar to the symptoms caused by prostate enlargement. And other conditions like overactive bladder, a stone in the bladder, and rarely malignancy in the bladder also can cause these type of irritative symptoms. And that's the reason why the patients with these symptoms, what I mentioned, should
Right.
consult a urologist, and not assuming that these are because of the prostate, and prostate enlarges with age and I have to live with these symptoms. That's wrong. So there can be other conditions and sometimes some serious conditions which can cause these symptoms, and you should consult a urologist.